If you're watching this video and you've noticed a new rash on your skin, you think it might be ringworm, but you're not sure and you're wondering how to treat it, well, in this video, I'm going to go through all the essentials you need to know. My name is Dr. Anne, and I'm a family doctor based in London. The reason that ringworm can be quite tricky to treat, and it's something I see in clinic all the time, is because ringworm can look like many other rashes. It can be really itchy, it can spread, it can grow, so a lot of my patients don't know what's going on. Some of my patients think it's eczema or psoriasis or an infection they've picked up like scabies. So today I'm going to give you the practical doctor's guide on whether it's ringworm and how to treat it. Let's start with a patient of mine called Nina. Nina noticed a small round rash on her abdomen area. She said she thought this was down to being cold as it was wintertime and her skin can get quite dry. She started to moisturize it, but she noticed it wasn't getting better. Nina then asked one of her housemates, and her housemates gave her an over-the-counter steroid cream. Nina started using the steroid cream and she noticed that the rash was looking less red. It was looking better for a few days, but then Nina noticed she had a new rash on her upper thigh. The rash looked similar to the one she'd had on her abdomen, so that's why she booked a doctor's appointment. She said both areas were round, scaly with an edge, and she noticed it was itchy but slowly expanding. This is one of the classic patterns for ringworm, and it's an important clue. So here I'm going to test you on a few quick questions. What is ringworm, and is it caused by worms? No, ringworm is a fungus. It's a superficial fungal infection of the skin. The medical term we use is called. And the reason it's called ringworm is because it often forms a ring with a border that looks active and scaly. It can be a ring-shaped or an oval-shaped, or sometimes it can be asymmetrical depending on the location of the rash. Where can ringworm appear? Ringworm can appear in most places on your body. The same fungi can show up in different places on your body. Then we tend to give it different names depending on where it's appearing. On the body, we call it ringworm. In the groin, we call it jock itch. On the feet, we call it athlete's foot. Fungal infections can also appear on your scalp or your nails. These can be a little bit trickier to treat. Next question for you. What does ringworm usually look and feel like? Most commonly, it starts off as a red or pink patch, and then it grows outwards. The edge is the most active part. The center usually looks a little bit less pink or clearer. The edge usually looks scaly or flaky or raised. Does it always look like a perfect ring? No, and that's why people miss it. Sometimes it can have an asymmetrical shape. On people with darker skin tones, it can look more brownish or reddish. And very early on, it can just look like a patch of dry skin. On the feet, it generally doesn't look like a ring at all. It's usually peeling and cracking between your toes. How fast does it spread? Usually it spreads slowly over days or weeks. If you see it expanding, this is a key clue that it could be a fungal infection. If you've been applying steroid cream, this could be one of the reasons it's starting to spread more quickly. The steroid creams can make the fungal infection look less red and less itchy, so you might not always know you still have the infection. Is it contagious? Yes, it can spread by direct skin-to-skin contact, or also by sharing towels, clothing, or bedding. What your doctor needs to know. When patients come to see me and they can tell me where it started, how long ago, how it's spreading, whether it's painful or discharging, and whether they have any other skin conditions or any other symptoms, these can be key clues in me working out it's a fungal infection. So what if it's not a fungal infection? What if something else is going on? What are the main rashes that people confuse with ringworm? The big ones are eczema, psoriasis, and pityriasis, rosea. How do we tend to tell the difference? With eczema, the skin is often dry and itchy, and it doesn't always have a clear border, it's a bit more spread. Eczema also tends to go away with steroid cream. Psoriasis normally presents with a thicker scale and often presents key areas like the scalp, the elbows, the knees, and it tends to have a more of a chronic picture. Pityriasis rosea. Often people get one small patch to start off with, and then over the next few weeks it spreads all over their trunk. The first patch can look a bit like ringworm, but then it's the way it spreads and moves that gives away the classic picture. How do doctors test for ringworm? When Nina came to see me, she said, "Doctor, how do we definitely know it's ringworm?" Well, we don't always need to test for it if it looks classically like ringworm, but in some cases we can test for it. We normally scrape away a little bit of the rash and we send it to the lab where they can look under a microscope. Under the microscope, they can see the fungi. Let me give you another story of one of my other patients. Jay is 19 and was living in student accommodation and playing football most days. He came in with an itchy patch on his thigh. He said it started after he'd been sharing towels in his locker room. He noted it could be fungal, so he started a cream and it gone away after 4 days. 2 weeks later, the rash came back and it looked bigger than last time, and Jay was worried, so he booked in to see me. Jay asked me, "Doctor, if the treatment had worked, why did it come back?" Jay started using the cream, and after 4 days the redness had disappeared. But that doesn't mean the inflammation or the fungal infection was completely gone. The active infection often lives on the edge of the rash, and you usually need to treat for 1 to 2 weeks before you definitely know the fungus is gone. So I told Jay that he needs to continue the treatment for 2 weeks to make sure the infection is definitely gone. So what's the simplest next step if you notice a rash like that today? Step 1, make sure it's definitely ringworm. If you're unsure, the rash is spreading, it's becoming painful, you've got a fever, you definitely should get it checked by a doctor. This is especially if you've got conditions like diabetes or you're immunocompromised. If you're feeling well in yourself and you think it looks like a fungal rash, you can go to the pharmacy and usually buy an antifungal cream. You need to make sure you apply the cream to the edge and just beyond it. Step 3, you need to make sure the infection is fully treated, so make sure you continue using the cream for the advised length of time. Don't stop it too early. Step 4, you need to make sure the infection isn't coming back, so no more sharing towels and reintroducing infection back in. How long should it take before your symptoms improve? Often you'll notice the rash improving in a few days and you're much less itchy, but it's usually after around 2 weeks that the infection is fully gone. If you've been using the cream for 2 weeks and the rash hasn't gone, that's when it's important to see a doctor. Do you ever need antifungal tablets, or is it always antifungal creams? If it's a widespread rash that's spread all over the body, it's involving the scalp or a hard to treat area, or you've got other health conditions like diabetes or you're immunocompromised, again, before you start oral antifungals, you will need to speak to a doctor to get the prescription and to make sure it's safe for you. What's the most common mistakes I see as a doctor? Treating only one area. If you've got athlete's foot and you've got a patch on your thigh and you only treat one area and you touch the other area, you could still be spreading the infection over your body. So it's important to treat all the sites at the same time. Next mistake. If you're re-wearing sweaty clothes, you're re-sharing towels or gym equipment, the fungus might be spreading from one person to another, so you need to make sure you're not reintroducing infection back to yourself. Next mistake. Fungus loves warm, sweaty, damp environments. So if you're doing a lot of sport and you're keeping those clothes on for a long time, this will allow the perfect environment for the fungus to keep growing. So you need to change and keep the area nice, dry and clean. One of Jay's biggest concerns is, "Doctor, I'm doing sports with all my friends. Am I contagious?" Once you've started the antifungal treatment, you're not sharing equipment or towels, you're keeping that area nicely covered and dry, the risk of spread rapidly reduces. You don't need to isolate yourself, but you should avoid sharing towels and close skin-to-skin contact. Another question that Jay wanted to know is, "Doctor, is the infection coming because I'm not keeping myself clean?" I explained it's not to do with hygiene, but the fungus having the perfect environment to spread. You can be a very clean person and still catch ringworm. Jay asked me, "Doctor, if it comes back in a couple of months, is it something that can go away on its own, or does it always need treatment?" Sometimes if you have mild ringworm, it could just improve, but the majority will need antifungal creams. Treating it early usually avoids it spreading. When do I need to worry about my ringworm? With all my patients like Jay and Nina, I give them clear signs to watch out for. If the rash is rapidly spreading, it's becoming painful, it's giving discharge, you're feeling feverish, it's important to get medical advice so we're sure what's going on. Thank you for watching today's video. If I can ask for a favor, if you click the word subscribe, it really helps my channel to keep on growing.